I think we've all heard of tech neck, but what exactly does all that time on our phones do to our posture and spine health? Well, Dr. Saman Farr is here from Arkansas Surgical Hospital to tell us about it. So I think a lot of parents worry about this too with their kids.
Yes.
I know I do. So what exactly is tech neck?
So tech neck, you might also have heard a term called text neck.
Right.
Kind of similar. We use that to describe the injury that we see in the neck and neck pain as a result of just looking down at our electronic devices for prolonged periods of time.
And so this is a real thing. You know, I think my daughter, when I tell her about it, she thinks I'm making it up just to get her off of her phone.
Yeah.
But it is actually something, it's pretty common now.
It's very common. So, you know, everybody owns cell phones these days, especially in the US. And there's, you know, a lot to be said for looking down and the amount of stress it puts on the neck. So a lot of the biomechanical studies that they've done, it actually shows, you know, when you're in a neutral position with your ears above your shoulder, the head puts maybe about 10 pounds of pressure on your neck. And when you bend forward to about a 45 degree, that comes to about 50 pounds of pressure.
Really? 50 pounds?
Yeah.
So from 10 to 50?
So it gets multiplied.
Really increases.
Yeah.
What are some of the symptoms that you're seeing with tech neck?
So typically it starts as kind of like a sore neck. Some people describe kind of a stabbing sensation in the back of the neck, just at the bottom. It's from those forces that we talked about.
Yeah.
And then that can lead to more serious issues when the nerves start getting pinched. You start to get pain shooting down the arms, the hands.
And it gets worse over time, I'm guessing?
It can get worse over time, and then eventually if it leads to weakness in the hands is when we really start to worry.
Yeah.
And also it can lead to just a permanent deformity in the neck where, you know, they're kind of looking down like
this. Yeah. And so you worry about that, you know, with the younger generation because they've always been on their phone.
Exactly.
Oh my goodness. Okay, what can be done to prevent some long-term issues?
So obviously the best thing is just to be mindful of your posture. But if you find yourself, you know, looking down a lot, the studies show if you're able to limit your reflection to just 15 degrees, it reduces your risk quite a bit.
Oh my goodness. So if you're going to be on your phone, don't do this the entire time.
Yeah.
Wow. Okay, so if this, I mean, you know, smartphones, this is the problem, and they haven't been around really all that long, and you're already seeing the damage that it's causing.
You are.
Yeah, so when is it time to see a specialist?
So in general, I just say, you know, if you're concerned about your symptoms, it's just good to see your family doctor and have them evaluate you and see if you should see a specialist. But some of the symptoms to look out for, you know, some of those things that we talked about with pain shooting down or weakness, those can be a symptom of something more serious.
Yeah.
So your spinal cord could be getting pinched, your nerves could be getting pinched.
And so what are some of the treatment options if it is tech neck?
Well, I like to start with like not scaring people and just talking about less invasive things first. Things like physical therapy, exercises, those kinds of things can help, medications. But beyond that, if the pain is chronic and medications aren't helping, there's injections that you can do. So if the facet joints in the neck are what's causing the pain, you can inject some steroids in there to reduce the inflammation. But beyond that, then we start talking about some surgical options.
Yeah.
So.
Well, at least there are different levels of options that are out there. But just preventing it is probably the best option.
Exactly.
Well, Dr. Farr, this is so great. Make sure you check out Arkansas Surgical Hospital for more information, and just remember these tips from Dr. Farr today, and that way you won't have to deal with tech neck before it even starts. Thank you so much.
Yeah.